Hello everybody, this is Dr. S.R. Arvind. I am a diabetologist from Bangalore. I am also the president of Diabetes India. I was the past president of the Research Society for Study of Diabetes in India in 2015-2016. Today I am here to tell you something about diabetes. People already know a lot of things about diabetes, but let me come out with the numbers. It's a mind-boggling number. In the world, India has taken the second place as far as the number of diabetics are concerned, next only to China. We are left behind even the United States of America. If you want to know the number, this is what it is. We have 77 million diabetics who are diagnosed. Wow, that's a big number. It doesn't end there. You have close to 25 million people who are pre-diabetics. That means they are one step behind from getting diabetes. Now, if somebody wants to know what do you mean by one step, we call them as impaired glucose tolerance. That means, just to give you an example, if diabetes is the 100th step, probably this pre-diabetics are in the 50th step. And what are the chances of developing diabetes in this group? At least 20% of these diabetics progress or go on to become diabetics in less than 1 year's time. So that's a big number. So we have 77 million people and 20% of 25 million pre-diabetics go on to join this group of 77 million each year, and that's a big number. The story doesn't end there. We have a big problem in India. We have 44 million people walking around in the roads of our country with diabetes, with high blood sugars, without knowing that they have diabetes. Now that's something very serious. And why is it happening? If you actually read the books, the classical symptoms of diabetes are increased urination, thirst, weakness, wounds not healing on time, you may have some genital infection, or you may go for a routine test and you get picked up. But in India, close to 80% of our population do not know that they have diabetes. Diabetes is asymptomatic in most of the Indians. This is a problem that is very big. And diabetes is not alone. Diabetes has some deadly cousins. You have blood pressure, you have high lipid levels or dyslipidemia, and you also have obesity. So these four together are creating a lot of problem in India and increasing the risk of cardiovascular diseases. In fact, there's been a rise by 1.5 times in cardiovascular deaths because of these 3 or 4 things coming together. Not only hyperglycemia or high blood sugar is asymptomatic, we also know that blood pressure is asymptomatic, high cholesterol is asymptomatic. It's like, well, nothing has ever happened to me, therefore I have not tested, is what most of the people say, and nothing will happen to you. It's like writing a letter to a friend with no hands and waiting for a reply. What are the chances of developing diabetes in India? Well, we know it's genetic. Basically, type 2 diabetes is what I'm talking about, because that's the main problem that we have. Type 1 diabetes that we used to see in children is also on a rise, but I will come to that another time. Type 2 diabetes is hereditary. That means you inherit the genes from your parents. If both parents have diabetes, your chances are 99%, or I can say 100%. If one parent has diabetes, other one has a family history of diabetes, you still are born with a chance of 70%. That means this is the first gift that your parents are actually giving you even before they name you. So it is hereditary, and we can't change our parents. Indians are born with a gene called insulin resistant gene or a trypto gene, or whatever may be the reasons, we have bad genes. And then overweight is a big triggering factor for people to go on and develop diabetes. It can also be pregnancy, it can be inactivity, it can be overeating, it can be pure genes. So there are a number of factors which can trigger diabetes. In fact, We used to see diabetes above the age of 50, 60 about 2 decades back. Today, we are seeing diabetes under the age of 40, and then it's also happening in the age group of 15 to 18, type 2 diabetes. So this is the burden we face. What do you have to do? If you have a diabetic in your house, either your father, mother, or even your grandparents, if you are above the age of 25, what I request you to do is please check for diabetes once in 6 months at least. Check also for blood pressure and your high cholesterol levels. You may not get any symptoms because of all three of them, but do not wait for the symptoms. It is asymptomatic. So things to remember: type 2 diabetes is genetic. Indians have a huge problem. If you are above the age of 25, please check every 6 months for diabetes, blood pressure and high cholesterol. Many people asking the same question. Can I not take sweets or sugar at all? Was the question that was being asked. Of course, you can take a small quantities of sweets and sugar. I'll tell you what it is. See, when you eat food, whatever food that you are eating is basically getting converted to three things. One is the fat, protein, and third one is the carbohydrate. So it's a carbohydrate which gets converted to glucose. And insulin comes in, makes use of the glucose, and then we have the energy and the life goes on. The problem in a patient with diabetes is, especially type 2 diabetes, there is a shortage of insulin. We say there are two problems with type 2 diabetes. One is insulin resistance and other is insulin deficiency. Therefore, whatever we eat depends on our activity level. So we always tell patients that try to eat something that slowly rises as sugar or which has probably a low glycemic index. I'll give you an example. If you have a wheat product directly, it may get converted to glucose slowly over a period of 1.5 hours. If you have rava, which is nothing but a simplified form of wheat, it may get converted to glucose in about an hour's time. If you have maida, it may get converted to glucose faster. So it's a simplified carbohydrate already. So you have complex carbohydrates, you have simple carbohydrates. Try to make use of taking more of complex carbohydrates, more of vegetables, more of fibers, so the rise in your blood glucose is slow. This does not mean that you cannot have sugar at all, because every carbohydrate that we eat is eventually getting converted to glucose in our stomach. So once in a way, if you would like to have a small sweet, or if you would like to have a small piece of cake, or if you would like to enjoy a little ice cream in a party, yes, please, sure, go ahead. You can always do that, but you must know how to count your calories. This is something that you always discuss with your doctors. This is something that you discuss with your dietitians, and they will tell you how to manage the portion size if you want to eat a sweet. It is absolutely possible. You can lead a very normal life, but don't overdo things, because your doctor and your dietitian knows the best for you. Especially if you are planning to lose weight, be careful with what calories is getting into your system, because you also have to burn more calories than what you are taking in to lose weight. It's always been the obesity which is triggering diabetes. So to come back to my first question, can I have a sweet once in a way? Can I take some sugar once in a way? Can I add half a spoon of sugar in my coffee, tea? Yes, you can do this. If you are well controlled, you can definitely do it. But please do not forget to discuss this with your doctor and dietitian. People don't really realize that diabetes can actually be harmful. People have heard a lot of things, they have googled a lot of things, and some people are scared and some people take it very easily. We have what is known as microvascular and macrovascular complications of diabetes. We also have acute and chronic complications of diabetes. The microvascular complications are directly related to diabetes. It can damage your eye, it can damage your kidney, it can damage the nerves in your leg, what we call as the neuropathy, retinopathy and nephropathy. Macrovascular complication basically means that your blood vessels in the heart can get clogged, you may have a heart attack, blood vessels in the leg can get clogged. If you have an infection, it may not heal, it may end up with an amputation. You can also have stroke. More importantly, I'll be talking about acute complications that people are worried about, what we call as low sugar or hypoglycemia. Any patient who is on a medication would have probably experienced what we call as hypo. Hypoglycemia is a state when your blood sugar levels go below the level of 70 milligrams per deciliter in the blood. Now, why do we have hypo? People who are taking insulin can have hypo. People who are taking some of the tablets called sulfonylureas can also have hypo. There are one set of drugs, what we call as SGLT2 or a DPP4, which may not cause hypo. So always talk to your doctors and ask your doctor whether the particular tablet that you are taking is likely to cause hypo or not. Now we'll come back to hypo. The reasons for hypo is very simple. Let us say you're taking insulin or tablets which can cause hypo. The reason for hypo is only two. When the medication becomes more, or when you eat less food, or when you delay taking your food. And immediately you get some symptoms and your body is already warning you. You get sweating, weakness, tremors in your hand, and you also have a tremendous amount of hunger. And slowly over a period of time, you can have blurring of vision, maybe even talk can become irrelevant or slurring of speech. All these are the symptoms of low sugar. Most of the time, the symptoms of low sugar is always told to the patient by the doctor. When you have a low sugar, please do not get worried. You don't die of low sugar. You get a lot of time to recognize the symptoms of low sugar. All that you have to do is take 2 or 3 spoons of sugar or a direct glucose, and within 5 to 10 minutes you are completely normal. Make sure you check your blood sugar at least 10 minutes after taking glucose, so that when once the sugars are normal, you can go about doing your normal activities. Also, your doctor would have told you, in case you have a hypoglycemic attack, how to reduce your medication. So before you leave your doctor's room, I want you people to know that discuss what medications can cause low sugar, and please discuss how you have to reduce your medication. The only problem that patients have is, what happens if I get hypoglycemia in the middle of the night when I'm sleeping? People think that they don't get symptoms. Trust me, you do get symptoms of hypoglycemia even if you are sleeping. Most of the time, in the majority of the patient, it will wake you up. You will have profuse sweating, weakness, hunger and tremors. Check your blood glucose with a glucometer and then immediately know the value is less than 70. Then take some glucose or take some sugar or whatever you can eat at that particular time, and within 10 to 15 minutes you are completely normal. So you don't really have to worry about it. Quickly readjust the dosage of medication and make sure that you always inform the doctor that you had low sugar. Sometimes you can have low sugar without you making any mistakes. For example, if you have a bout of loose motions, you can have a sudden onset of low sugar. So you should know this. Suppose you take some painkillers, they augment the action of insulin and you can have low sugar. So apart from you making mistakes or medication becoming excess, you can also have other reasons for low sugar, which your doctor will be able to identify and quickly tell you how to readjust this. Hypoglycemia is something that we have to understand and live with. You have to get educated about low sugar episodes. All the time when you are going out of the house, please make sure that you are carrying some candies or some sugar or some glucose tablets along with you. So in case you have hypo, immediately you know that you have something in your pocket to take and immediately become normal. Never do the mistake of walking out of the house without carrying some sweets or sugar or candies in your pocket. The simple things that we have to follow to protect our feet. And most of you who have diabetes already know that in case you have an injury to your foot, it may not get healed. But that's not true at all. I'll tell you what happens in diabetes. One of the microvascular complications of diabetes, that is a pure diabetic problem, is damage to the nerves. And we call this as diabetic polyneuropathy. When sugars are high, out of control, they damage the nerves, and the nerves of the leg are affected first. Most people do develop some symptoms when the damage is happening. They can have burning sensation in the sole of the feet, they can have tingling, they can have numbness, and some people also have frank pain. So when once you have some symptoms which is funny and which is unusual, which is not normal, immediately bring it to the notice of your doctor, and he will test for all the sensations to make sure that you don't have neuropathy. In fact, doctors test you for touch sensation, vibration sensation, temperature sensation, and also pain sensations, and then they will ask you to wear the right type of footwear. What happens many a times is patients coming from smaller places who do not have the knowledge that you can develop neuropathy and loss of all the sensations fail to tell a doctor that he has this problem or she has the problem. So when they walk barefoot, they can actually get injured. Many a times people go for holidays, they go to a beach resort, they walk barefoot on the beaches, and the sand can be very hot and the sole of the feet can actually get burnt. And the same thing can also happen in temples. When the stone outside a temple can be very hot and you walk barefoot, and suddenly you don't realize it because you have no sensations, and when you come back to the room or home, you realize that there is redness and then there is something which is happening in your feet. Important thing about neuropathy is to ensure that you take care of your diabetes well, you keep your sugars under target all the time, and make sure that you clean your feet and look at it every day. Many a times between the toes there can be fungus infection. People fail to clean between the toes. So we always tell the patients, soon after the bath, take a cloth and between the web spaces of the toe, please ensure that you clean it, and also take a look at the sole using a mirror. Make sure that there are no injuries that has gone unnoticed, and each time you visit your doctor, please ask the doctor to test for the sensations in your legs. Any alteration in the sensation of your foot, immediately you must make sure that you wear the right type of footwear and protect it. In fact, we do tell the patients they must wear a very comfortable canvas shoes when they go for a walk, and they must have a separate footwear to walk out and walk within the house. You get a number of footwear that are already made for diabetic patients with neuropathy. One of the simplest thing that is available is an MCR footwear, where it has a number of air pockets, so when you actually put your entire weight, it equally distributes your weight, so you may not get an ulcer in the sole of the feet. So important thing to remember is diabetic polyneuropathy is a complication of diabetes which affects your legs. You may get some numbness, tingling sensation, pain. Always when you go see your doctor, please ask your doctor to make sure that you don't have neuropathy. He will test for all your sensations and he will also teach you how to look for the sensation. And at the same time, the doctor will also check for the blood circulation in the legs, because if there is loss of blood circulation and neuropathy, that can be a deadly combination. And that's the time when you have an injury to the feet, the healing can get delayed and we may end up having problems. So follow the simple things, talk to your doctor, ask your doctor, take instructions about neuropathy, take care of your feet. We cannot be walking on our arms like a circus artist. So as long as we have to use our feet to walk, make sure you take care of your feet better than your face. Please remember, medication just forms one small part of your management. There are 4 pillars. The most important thing, of course, is the medication. Number 2 is always going to be your lifestyle changes with respect to diet, exercises. Now these 3 are the most important things: diet, exercise and medicines. But how do we bring them together? How do we balance them? It's the knowledge, it's the education about learning all aspects of diabetes. balancing your diet, exercises and medication. And when once you learn to balance these three through your knowledge which comes from the education of diabetes, it's very easy to manage diabetes. What do we tell the patients? Each patient is prescribed a particular diet based on the height, weight and the activities. We ask the patient, look, there is less of insulin in your body. Make sure what your body needs, but not what your mind wants. Many a times there is a tendency to overeat, so please sit with your dietitian or doctor, discuss this issue, because many patients do come and tell us, hunger is something that I can't really manage, so I end up eating. Hunger, trust me, is like buying something in shopping. Have we ever picked up a shirt or a pant or a sari because we don't have it? No. There is a desire to buy, and hunger is like that desire. Moment we look at food, hear about food, smell food, we love food, don't we? So we want to eat more food, but body doesn't need more food. Now what happens to the extra food? Let's say what happens to the extra food if you have more at dinner. You either keep it in your refrigerator, or you give it to somebody, or you throw it out. Unfortunately, the body does not have a refrigerator to keep or store the food. So the extra calories that gets built up is not utilized by the body. Body is not selfish. So the extra calories do get converted to fat, and that's how the body stores the extra energy, and then we put on weight. So talk to your dietitian, listen to your doctors, ensure you stick to the calories given to you for breakfast, lunch, evening snack and dinner. This is important. Eat food on time. That's the second important thing. This is mainly to avoid hypoglycemia or the excursions in the blood sugar. Second important thing is, of course, the medication. See, when you take the medication, always ask your doctor at what time I am supposed to take this tablet. There are some tablets which are taken before food and some tablets are taken after food. There are some insulin which needs to be taken half an hour before, some insulins 15 minutes before, and some insulins can be taken even after dinner. This your doctor will tell you. So please ask your doctor, find out at what time you have to take the medications the right way. The third is, of course, your exercises. You don't have to join a gym, but if you join a gym, it's fantastic. You have different types of exercises that you can do, and you also have company. Otherwise, all that it needs is a good 30 minutes of walking every day. 5 times a week is all that we want. You don't have to pick and choose a particular time. You don't have to write a timetable for your exercise. Go for a walk any time of the day. Start going for walks in the evenings or in the night after dinner, or you can pick and choose early morning. Even when you're working, please make sure that you climb the stairs. See if you can avoid taking an escalator wherever it is possible. Try to be as active as you can be, because the consumption of the glucose is much higher as you exercise, and the sensitivity of insulin improves as you exercise. And you learn all this through your discussions with the doctor and through the education that is provided. So you have to balance your diet, exercise, medication. Now the next question that comes up is, what is it that I can monitor? Trust me, diabetes is asymptomatic. It will not talk to you. Blood pressure is asymptomatic. It will not talk to you. Your cholesterol levels are asymptomatic. It will not talk to you. There are certain things that you need to monitor on a regular basis. Somebody on insulin, we tell the patients, please check your glucose values at least 2 to 3 times a week. Use your own glucometer that you have at home. Check your fasting post-breakfast, sometimes post-lunch, sometimes pre-dinner, post-dinner. Sometimes to avoid hypoglycemia, we may ask the patient to check blood glucose at 3 a.m. So talk to your doctor and find out at what time you have to check your blood sugar and what should be the target, and your doctor will advise you how to adjust your insulin dosage. So self-monitoring of blood glucose is something that you all have to do. Those who are on tablets can probably check their glucose values when they are under good control, maybe once in 10 to 15 days. And blood glucose meters are so easily available. They have become so inexpensive today. I am sure everyone will be able to afford one and must start keeping one at home. The second thing, of course, is the blood pressure. Many times I see patients coming and telling me, Doc, my blood pressure went up only when I came to the hospital. It's because of the tension and the pressure that I go through when I come to the hospital. And when I check at home, it's always normal. Believe me, blood pressure can vary from time to time. So we nowadays use what is known as ambulatory blood pressure. We tell the patients to put on a small blood pressure cuff, and then there is a meter which is attached to him, and for 24 hours we are checking his blood pressure. You don't have to do that. Keep a blood pressure meter at home. Check blood pressure at different times. As long as it is less than 140/90, you don't have to worry. Suppose you have diabetes for long periods of time, you have some changes in your eye, your doctor may say, no, I want your blood pressure below 130/80. So talk to your doctor, make sure that you actually set the target for your blood pressure, set the target for your glucose values, because these two are very, very important. Then you can't be checking sugars at different times of the day. You check maybe 2 times or 3 times a day. How do I know how I have done well over a period of 2 to 3 months? There is a test called glycated hemoglobin or glycosylated hemoglobin. Go to a lab which uses a very standardized method of testing your glycosylated hemoglobin. It is a number which tells you the average of the blood glucose over the last 60 to 90 days. And if you can get your glycosylated hemoglobin done once in 3 months, it's fantastic. But at least we recommend you do it 3 times a year so you know your overall control. When do we go for an eye checkup? Yes, once a year. If there is no problem, repeat after a year. But if there is a problem, your ophthalmologist will tell you when to come back for an eye test. And this is for checking your retina and not for your glasses. Retina is the back portion of your eye. It has got nothing to do with the glasses. Your ophthalmologist or your physician, nowadays the physicians themselves do this. You have automated machines which takes and gives the report within no time. So they will dilate your eye and you can get a photograph of your retina, which is the back portion of your eye, and immediately you know whether there is any bleeding or any complication. You also check for your kidney functions at least once a year, more often if required. Check for your cholesterol at least once in 6 months. People above the age of 55-60, even though the ECG is normal, I normally request patients, ECG can be normal and you can still have a cardiac event or a cardiac problem. Therefore, it's always good to check for your it's always good to test for your stress test, or maybe go for an angiogram if your cardiologist tells you. And this can be done maybe once in 2 to 3 years. Get an ECG done every year. Stress test, if you can afford it, maybe once in 2 years. And nowadays you have screening MRI angios which can be done once in 3 to 4 years. So once you are monitoring your blood sugars, blood pressure, lipids, renal functions, your heart, and if you are taking care of your feet, you are done. You are good to go for 80 years. In fact, a diabetic today lives longer than non-diabetics just because you are more disciplined than most of the other people. In fact, people who do not have diabetes hardly go see a doctor. If you have diabetes, you see the doctor at least 4 to 5 times a year. Your systems are getting checked. And therefore, you can be more disciplined, and with discipline, you are going to live longer than non-diabetics. Don't ever think that diabetics have a short lifespan. No, you're going to live longer than all others. One of the important things that is happening with complications today is the rise in the cardiovascular events. Now, why is it happening? Diabetes itself increases the risk of a heart attack by almost 2.5 times. Now, diabetes along with blood pressure increases it further. Diabetes plus blood pressure plus high cholesterol further worsens the situation. Diabetes blood pressure, high cholesterol, overweight. That's a recipe for disaster. Now you have people who have all the four of them. Yet they continue to smoke, they do not exercise. So you can imagine why the events of heart attack is on a rise in our country. Not only diabetes, but it's a combination of diabetes, blood pressure, high cholesterol, overweight, and lack of physical activity. And smoking is something everyone should stop. And definitely, if you have diabetes, please do not smoke. It's a definite and a sure recipe for a future heart attack. And heart attacks also are asymptomatic in many diabetics. They are surprised many a times when we tell them that your ECG shows that you have had a heart attack. They have not even realized it. So when you go to the doctor, it becomes your duty to discuss these things as the doctor. And especially if you are a smoker, before I sign off, I want to tell you, please stop smoking. Please reduce your weight. Walk daily. Try to cut down your weight as much as possible. Eat on time. Eat right. Monitor your glucose, BP at home. Rest of the things your doctor can do. I did tell you about the burden of diabetes. I also mentioned why diabetes comes. Indians have a higher susceptibility to develop diabetes basically because of our genes. So it's genetics. We can't change our parents. If both parents have diabetes, our chances become 100%. If one of them has diabetes, 60%. With nobody having diabetes, it is still 40%. 77 million people are already there with diabetes in India. 25 million have impaired glucose tolerance. So each year 20% of them are now getting converted to diabetes, and most importantly 45 million people are not diagnosed and walking around in the roads of India with high blood glucose. Now the problem is, at what age do we get diabetes? Trust me, 30 years back we would see diabetes in the age group of 55 and above 60. It used to be a disorder which would hit elderly population. 20 years back, we started seeing diabetes coming below the age of 50. Now, 50% of newly detected diabetics in India are below the age of 40. At the best period of their life, they are developing diabetes, and we need to really look into this. Now, we are also seeing type 2 diabetes in the age group of 15 and above. 10th standard, first PUC, second PUC, first year of engineering. This is a time when young boys are developing diabetes. Now, why is it happening? What are the triggering factors of diabetes? Now, you may be born with a gene to develop diabetes, but you need not have to develop diabetes. Many people ask me the same question: what is it that I can do so that I don't get diabetes in future? Well, the few things that has been proved medically is change in your lifestyle. Obesity is the biggest single triggering factor to diabetes. So you must maintain a normal weight. Many people ask the same question: what is my normal weight? You don't have to stand on a weighing machine. Please don't even worry about the body mass index. We can tell you, if you have a BMI of 23, which is an ideal weight for you, anything up to 25 is okay in India, but definitely not more than 25 BMI. Now, when we talk of BMI, people do get confused. Doc, tell me, what should my weight be? I will tell you in simple terms. Take a measuring tape. Your waist gives you the best indication whether you are overweight or not. If you are male, your waist should be less than 90 centimeters, or 90 centimeters should be the upper limit. Anything more than 90 centimeters, you have central obesity, you are not fit. For ladies or female, it is 80 centimeters. So that should be the waistline we should have to avoid the central obesity. Sometimes BMI may not be the right indicator, but your waistline can be the right indicator. So when you visit your family doctor next time, you can always check your weight and then try to find out what is your ideal body weight and what is your BMI. Any calculator will tell you how to do a BMI. So see that your BMI is around 23 and definitely not more than 25. For that you have to eat right and you have to exercise. Keep some physical activity going on a regular basis. Most of the youngsters today are so much into reading, so much into other activities, they forget that they can actually go out and enjoy themselves playing. People who take up sports are absolutely okay, but those who do not take up sports, please go to the gym or please take a cycle and go for cycling, or if nothing is available, go for a walk. Walk for half an hour to 45 minutes every day. You can split it into two halves. If you say I don't get 1 hour time, split it into two halves. So reducing weight and keeping a regular physical activity, you can definitely postpone getting diabetes. Right now, we also tell our people and our youngsters, eat right. When you are half full, try to get up from the table. Just because the food is good, that does not mean you have to eat right. See if you can avoid fatty food, junk food, stick to the home food as much as possible. Yes, you have all the right to go to a restaurant and enjoy a good meal once a week, but don't make it a habit and try to eat food from outside on all the days. Any fat that solidifies in room temperature is not good, so try to avoid fatty foods. Try to avoid things which are too sweet, which is high in calorie load. Try to mix your food, eat a lot of salads, try to fill up your stomach, eat a lot of fibers. Whenever you see your doctor the next time, just talk to the doctor and ask him what is the right food for me and what is a balanced diet. It's a good mixture of 10% fat, probably 30% protein, and maybe about 60% carbohydrate, with half an hour to 45 minutes of walking and maintaining your ideal body weight. This is the only mantra that we have today to actually postpone getting diabetes. And also I would like to tell all of you, diabetes can be completely asymptomatic in India. So you may be having diabetes, you may be having blood pressure and you don't even know about it. So if you are above the age of 25, even now I urge people to go for a test at least once a year to see whether they have diabetes, blood pressure or cholesterol. Don't say that I was not warned, because diabetes is asymptomatic and you need to know only through testing. Thank you.
For more health-related videos, like, share and subscribe to Hello Healthy.